This is Dr. Kevin Ende again discussing Dr. Epstein's article on hairline lowering. This is just another video in the series of videos discussing hairline lowering in regards to Dr. Epstein's recent article on the topic describing our original technique. Dr. Epstein basically discusses how one can predict how far a hairline can be advanced. And certainly you can try to do this preoperatively, and it is fairly accurate in my experience, of just trying to pull your forehead skin forward and pulling the hairline forward with it from a fixed point. So if a ruler is placed right basically at this point and then is kept in this area as one is pulling forward on their hairline, you can see how much you can pull the hairline down. Now that's not the total amount that you can actually pull a hairline down. You can also do goniotomies. Now goniotomies are a specific technique that we've been doing since the first procedure that we ever performed on hairline lowering, and I'm glad that Dr. Epstein is also using that technique and has seen the benefit of the fact that it can advance the hairline about 5 to 10 millimeters further, which is almost potentially a full centimeter more forward than you can actually do when you pull the skin yourself. So again, if you have a ruler placed right here and you keep it in that point, but yet you pull forward on your hairline, meaning pulling down to bring the hairline forward onto the forehead skin like this, you should be able to see how far you can displace your hairline to see if it's too tight for the procedure, and then you can judge that you can do about another half a centimeter to a centimeter beyond that to actually know where the maximum amount of hairline advancement you can get. Dr. Epstein does go on to discuss that there are other options for advancing the hairline, and as most of you know from reading my website and reading the original article that I produced, we've been doing scalp expansions for this procedure for quite some time now. I call this a two-stage procedure because, again, the scalp expander is placed and then it is expanded to the desired amount over the next 4 to 12 weeks, depending on, of course, how much advancement one needs. And then a very similar procedure to the single-stage procedure is then performed. So I'm glad that Dr. Epstein has seen the benefit of these two different techniques and has been able to judge how far one can advance the hairline with one of these procedures.